Hey everyone! Hope you all have been having a great week. Mine has been pretty busy. I have an exam coming up, so I've been doing a lot of studying, and I've had an offsite earlier this week. Which brings me to the title of this video, Clinical Offsites and Shadowing. So in this video, I'm going to talk about what are clinical offsites, how to prepare for them, and what to kind of expect. For those of you guys who don't know, clinical offsites are exactly what they sound like. They're opportunities for you to shadow and see what a day in the life of a physician really is like. First thing you want to do is familiarize yourself with the field of the specialist or the physician that you're going to be shadowing. As a first or second year medical student, you're not going to be expected to know a lot of the specifics of their field, but what you are expected to know are the basics. Basic physiology of the body or the disease state. If you're going to a hospital, you're going to need your white coat and your medical student ID. You'll want to bring some essential things for physical exam taking, such as your stethoscope, your reflex hammer, and your pen light. Most other things, such as a blood pressure cuff, ophthalmoscope, otoscope, will be provided for at the site. You're going to want to bring a pen or some kind of writing utensil and something to write things down. You're going to want to bring a water bottle as well and a snack. So my first tip is to be enthusiastic. Be an active participant and ask questions. I know it can be very intimidating, but show them that you want to be there. My second tip is not to be afraid to ask questions. Ask some of the nurses who are there, ask other older medical students who are there, or even the interns and residents. They know what you don't know, and they've been in your shoes. The majority of the time, I'm sure they'll be helpful. And my last tip is to keep in mind why you're there. This is to help the patient. If you're able to help one of your physician's patients, you'll be able to go home knowing that you really made a difference in someone's life that day. So after the clinical offsite, I highly recommend you taking some time to reflect upon the experience. And keep in mind that what you're seeing is kind of a slice into someone's life, just a glimpse into one experience. It doesn't define it completely. And lastly, if this was a great experience, I would highly recommend you reach out to the physician and thank them somehow. You want to let them know how much you appreciate their time. And those are all the tips I have on clinical offsites. I have loved so many of mine this year and have had the greatest experiences. I hope you guys do too. If you have any more questions, leave them or make a comment below.